Cardizem is a calcium channel blocker. It works by relaxing the muscles of the heart and blood vessels. Cardizem is used to treat hypertension, high blood pressure. It may be used alone or in combination with other high blood pressure medications. Cardizem is also used to treat chronic stable angina, chest pain, and angina due to coronary artery spasm. Indications. Cardizem is indicated for the management of chronic stable angina and angina due to coronary artery spasm. How to use. Exertional angina pectoris due to atherosclerosis, coronary artery disease, or angina pectoris at rest due to coronary artery spasm. Dosage must be adjusted to each patient's needs. Starting with 30 mg 4 times daily before meals and at bedtime, dosage should be increased gradually, given in divided doses 3 or 4 times daily at 1 to 2 day intervals until optimal response is obtained. Although individual patients may respond to any dosage level, the average optimum dosage range appears to be 180 mg to 360 mg per day. There are no available data concerning dosage requirements in patients with impaired renal or hepatic function. If the drug must be used in such patients, titration should be carried out with particular caution. Contraindications. You should not use Cardizem if you are allergic to Dosage, or if you have a serious heart condition such as sick sinus syndrome or EV block, unless you have a pacemaker, very low blood pressure, if you have recently had a heart attack, or if you have a build-up of fluid in your lungs. To make sure Cardizem is safe for you, tell doctor if you have kidney disease, liver disease, congestive heart failure, or if you also take digoxin or a beta blockers, such as atenolol, carvedilol, metoprolol, propranolol, sotalol, and others. Precautions. Grapefruit and grapefruit juice may interact with Cardizem and lead to unwanted side effects. Discuss the use of grapefruit product with your doctor. Cardizem may impair your thinking or reactions. Be careful if you drive or do anything that requires you to be alert. Before taking Cardizem, tell doctor if you have kidney disease, liver disease, or congestive heart failure. Avoid drinking alcohol while taking Cardizem. Cardizem side effects. Get emergency medical help if you have signs of an allergic reaction to Cardizem, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Call doctor at once if you have slow heartbeats. Slow heartbeats or fluttering in your chest, a lightheaded feeling like you might pass out, heart problems, shortness of breath, even with mild exertion. Swelling, rapid weight gain, liver problems, nausea, upper stomach pain, itching, tight feeling, loss of appetite, dark urine, clay-colored stools, jaundice, yellowing of the skin or eyes. Severe skin reaction, fever, sore throat, swelling in the face or tongue, burning in the eyes, skin pain followed by a red or purple skin rash that spreads, especially in the face or upper body, and causes blistering and peeling. Common Cardizem side effects may include dizziness, weakness, headache, nausea, or rash.